Now, we will discuss the data management in contact tracing. Not everyone is cut out for reporting, but at the end of the day, this is an accounting of what we have done. DOH is not able to do the daily reporting as well as in the analysis without the reports of the contact tracers and the reports from the surveillance officers. So now, let's move to the guidelines and issuances. DOH issued the Department Circular 2020-0201 mandating the utilization of the COVID-Kaya information system for close contact data and reporting of contact tracing data. COVID-Kaya endeavors to support the global community and provide community-centric IT tools to help proactive response and decision-making by authorities, while also extending peer-to-peer support through local communities. If you notice that every 15 days, the IATF meets at the national level and update the quarantine classification of different places. One of the agenda is the contact tracing. The minimum data that will be generated by COVID-Kaya information systems are case information, which is classified as suspect, probable, and confirmed COVID-19 cases. The close contact information made by our contact tracers, and the report of laboratory specimen monitoring or tracking report. This is the face of our COVID-Kaya. Who now needs to report? In the DOH, there is no official information system that is not anchored in the laws. And these laws have administrative orders, department circulars, or memos to support these laws. In DOH Department Circular 2020-0197, mandating the use of COVID-Kaya, all health facilities, community quarantine units, and temporary treatment and monitoring facilities, or the TTMF, catering to suspect, probable, and/or confirmed COVID-19 patients must be reported. What are the reporting forms of COVID-Kaya? To protect contact tracers, these are the necessary forms of COVID-Kaya. The Form A, the Contact Investigation Form. Form B, the Travel History and Events. And the Form C, which is the Close Contact Line List. So this is Form A, and is used once we identify the suspect or probable case in COVID-19. Then this is Form B, or the Travel History and Events Form. This is the assessment made by our contact tracers. Once we have identified a close contact, we will use this form. This is Form C, or the Close Contact Line List form. In this form, you can see the nature of contact and its kind, which can be seen in the third column starting from the right. And these are HH for household, WS for workstation, S for sea vessel, T for travel, A for accommodation, HCW for healthcare worker, and O or others not mentioned. And now let's proceed to the confidentiality and ethics of contact tracing. For our protection, public health practitioners often have legal requirements to act to contain a communicable disease within a broader population and also cite an ethical duty to warn individuals of their exposure. Simultaneously, infected individuals have a recognized right to medical confidentiality. We should not post in social media of what we know about the person infected by COVID-19. Public health teams typically disclose the minimum amount of information required to achieve the objectives of contact tracing. How can we ensure that? Only contacts are told that they have been exposed to a particular infection, but not informed of the person who was the source of the exposure. The confidentiality and risk of stigma. If the social mobilization or advocacy campaign of our healthcare workers were not good, it will affect the privacy of the COVID-19 patients. Fear of loss of confidentiality, subsequent stigma, discrimination, or abuse may discourage persons from seeking medical treatment. Please note, public health officials have recognized that the goals of contact tracing must be balanced with maintenance of trust or with vulnerable and sensitivity to individual situations. The Data Privacy Act of 2012 is not a hindrance to the COVID-19 response. It allows contact tracing, treating patients, and addressing threats. It guarantees privacy of COVID-19 positive patients, suspect cases, and close contacts. Republic Act No. 11332, an act providing policies and prescribing procedures on surveillance and response to notifiable diseases, epidemics, and health events of public health concern. It mandates cases and close contacts to be fully transparent and truthful to the health authorities on personal data with travel and medical history to contain the spread of the infectious disease in a timely manner. Not all data is required, but only pertinent data during the periods that we discussed earlier. From the day 0 to 2 days prior and 14 days onward depending on the condition of the patient, either asymptomatic or moderate to severe case of COVID-19. That's all we need to prepare. So that ends my presentation. Thank you so much.